Hello, my name is Jeanne Byquist. I'm the cancer program dietitian here at the Tammy Walker Cancer Center. And I have worked in the area of oncology since 2001. For many years I was a dietitian at the acute care campus at Salina Regional Health Center. And eventually it segued to being over here at the Tammy Walker Cancer Center full time. My vision for this was to teach a class for breast cancer survivors and nutrition recommendations, and basically when a person gets done with treatment for their breast cancer, I normally would go through and provide whatever topics of interest the patient states they're interested in as far as breast cancer survivorship. But the problem we have here at the center is we have a varied age group. We have women that are older and retired, and we have women that continue to work as they go through treatment. And so really doing a class was really tough to find a time, and so my answer to this was to have this videotaped, and all of the handouts and resources I'm going to reference today, I'm more than happy to certainly mail a person handouts, or if you see this before you're done with treatment, I can certainly provide you with these handouts at the end of your treatment or in your journey when you think they would be most appropriate and useful for you. I'm going to kind of start out with a little summary of what the high points of my talk are, and hopefully you'll get what I'm basically trying to say today in a nutshell. Basically, I tell patients that the takeaway points is we do know that weight loss will, if you are overweight, the weight loss will definitely decrease your risk for breast cancer recurrence. This has been showed and proven in many studies. Research studies have also shown that women that are overweight or gain weight after diagnosis, we know have a greater risk for a reoccurrence of breast cancer. These women also, unfortunately, have a worse prognosis when they are compared to women of a normal body weight. So I'm going to tell you that I want you to really try to work hard to become more of a whole foods eater. By that I mean I don't want you to eat a lot of processed foods and a lot of foods that have had a lot of additives put in them when they're processed. I really want you to work on making half of your plate fruits and veggies and whole grains, and I want you to use non-fat or low-fat milk, dairy, yogurt, cheese products. Another thing is to make a quarter of your plate a lean protein choice, and the biggest thing is probably to pay attention to your portion sizes, and that, as you know from just, I know everybody listening has eaten at a restaurant where they probably give you about 4 times what the portion size should be for the main entree. And so I'll talk a little bit also about how to get away from doing that, or just tips or strategies to help with that when you do eat out. The other thing is it's really important to balance your caloric intake with your physical activity each day. There again, a lot of research studies have proven that even if you lose 5 to 10% of your baseline weight, that can be useful in lowering your blood sugar, lowering your blood pressure, lowering your cholesterol levels. So we do know that a very minimal amount of weight loss, for example, if you weigh 125 pounds and you lose even 5%, that would be about 7 pounds. And even that, which is not a huge goal in my opinion, is really doable, and you can get some good results from that. If you do drink alcoholic beverages, we do know that you want to try to limit your intake to no more than 1 drink a day. That would be a 5-ounce glass of wine, or a 1 beer that's 12 ounces, or a 1.5 ounce if you were drinking a hard liquor. Another thing is that is certainly all the recommendations that I'm going to visit about today basically are from the American Cancer Society as well as the American Institute for Cancer Research. So I do have these websites available, and there again, if you really are into it and you want to know more information, certainly you can access them. So that really in a nutshell is going to be what I'm going to emphasize. I'm going to include some hot topics, or if you will, just I think a lot of the same questions that I get asked over and over that women are really interested in as far as breast cancer survivorship, and hopefully I will address any question you might have. And I've even brought some visual aids here with me today, and I have some different cookbook resources that we'll be visiting a little bit about. So without any further delay, basically nutrition during and after treatment. This is a handout that I give out. It's very, in my opinion, basic. Probably a lot of the information on here we all know, but we tend to not always practice, and it can be difficult. When I tell a patient to try to make some lifestyle changes, I really emphasize to do this in baby steps, and maybe make only 1 or 2 goals initially. Don't try to say, we tend to get the phenomenon, I call it like the first day of the year, or making a New Year's resolution, where we get so much going on our plate, in like 2 weeks you're gonna fail at it. And so I really try to emphasize to patients, just pick 1 or 2 small goals, and when that becomes a habit, and that's gonna take probably a month, maybe 6 weeks before it's a habit, then when you can do that goal without even thinking about it, it just comes very natural, that change, then you can move on to another step or another goal. So the first thing might be, maybe you like to eat fried chicken and you have fried chicken twice a week. And when you get to the point where you can say, well, I don't need fried chicken or any fried food, maybe more than 1 time a week, and that's your goal. And when you get to that, where that comes really easy to you, then I would tell you to go on to the next goal. But basically, this nutrition during and after cancer handout, it gives you a little bit of information about an action plan and how to achieve and maintain a healthy weight and being physically active. It tells you basically we want to eat more of a plant-based diet, and there we're back to the fruits and the vegetables and the whole grains. And you want to try to use a lot of color in your diet. We know that the plant-based diet, those foods contain a lot of antioxidants and phytochemicals, and we know that those are very good as we if our immune system is weakened or as we age. We know that that helps actually reduce the inflammation effect that we get in our body as we age, and that's just like a natural process. I equate it to like if you've ever cut open an apple and you got interrupted, you let that apple sit there and you come back and you're like, oh wow, it's kind of started getting brown. And that's basically what those antioxidants are about, is to help your body not have that effect going on. So another thing we want to do is eat more high fiber foods in our diet. One food that I recommend often is called milled flaxseed. This is an omega-3 fatty acid. Our body cannot manufacture this. We have to get it from a dietary resource. And the good news about this is actually a heart-healthy food, as well as helping with just inflammation in general in the body. I do warn patients that it is a whole grain, and whenever you start including more fiber in your diet, talking to you right now, I don't have any idea if you include 4 or 5 grams of fiber a day versus the recommended 25 to 30 grams a day, which is pretty, like I said, that's a healthy amount. But if you don't do it, you just don't want to jump up from like 5 grams to 15 or 20 grams, because you're going to, number one, you're going to need to increase drinking a lot of water to help your body metabolize all that fiber. You may get a lot of gas and bloating, and you just aren't going to feel very good if you do it too quickly. So I usually say to a patient, just add a gram or 2 a week if you're trying to increase your fiber. And that might be your one goal that you start with, is just trying to get more fiber in the diet. And so there again, this is a milled flaxseed. I have an example of what the whole little flax seeds look like. They're just little tiny brown seeds. But you do want to go with the milled, and you can cook with it. There's actually some recipes on the product box when you buy the milled flaxseed. And there again, make sure you include a lot more water. And like I told you, just start making sure that you do this really gradual, no matter what it is. But there again, there's actually been a small study that says that that a high fiber diet can actually bind to the extra estrogen in your body. And so for you women that were an estrogen receptor positive cancer, There's some study and research that shows that eating more fiber binds to that estrogen, and then you just excrete it when you go to the bathroom. And so that's another reason to really try to work at a higher fiber diet. There again, back to the handout on nutrition during and after treatment. It gives you some plant foods that are great sources of protein, things like beans, seeds, and legumes. It gives you some good plant foods that are a good source of complex carbs. Fiber is really good in that it will help you feel more satisfied. That's another reason when we talk about dairy, I usually say don't go to totally fat-free foods, but go to a reduced fat, because you will at least get a little bit more satisfied feeling when you do eat, if you're just not, really limiting too much fat in your diet. The next handout is really, anybody can go to this website, and it's called myplate.gov. Basically, it's by the USDA. I really like this website now. It used to be years ago. It talked a lot about the food guide pyramid, and they've really moved away from that, which I think is a good thing, because the food guide pyramid really wasn't very useful to the average individual. Had all these symbols and signs, and nobody really knew what they stood for. Whereas this handout, I really think, gives you some very great strategic steps to help improve your diet, and just some great suggestions. And the whole website is awesome. They have a tracker, a diet tracker on that website. It's called the Super Tracker. It's on here, the website, that you can put in your height, your weight, your age, and how active you are, and that will actually figure your calorie needs for you. It also has a Foodopedia, basically database that you can put in any kind of food product, and it will tell you the nutrient analysis of that food product, how much calories is in it, how much protein in it, all the breakdown. So this is another really good handout, and there again it gives you the information about that website. I have another handout that gets a little more specific about a plant-based diet. There again, it talks a little bit about what phytochemicals are, talks about all, trying to experiment with all the different colors of fruits and vegetables. I love it because it actually goes through the color and tells you the plant food, and it tells you some strategies to actually get more plant foods into your diet. So this also gives you additional resources from the American Institute on Cancer Research, and in here, it also, there's recipes on that website that will pertain to that. Another really hot topic I have found when I'm talking with patients is organic food. We all know good friends and relatives that are trying to be helpful when you're diagnosed with a scary disease like cancer, and everybody means well, but a lot of times I worry because patients get inaccurate information that is not based on scientific evidence-based research. And the organic food and cancer handout is basically talks a little bit about organic foods better for you. And I would want everybody to realize it would be a red flag to me if I had a patient say, well, I cannot afford to eat organic foods, so therefore I'm just not going to eat any fruits and vegetables. I would be so much more worried about that than if a patient just said, well, I can't afford to eat organic, but I do buy lots of fruits and vegetables, and I use a veggie wash, or I wash them in a week at vinegar and water solution. To me, that's what I encourage patients to do if they're worried about that. Probably the most important statement on this handout is that when it comes to health benefits, there's really not been any direct studies on humans to show that organic foods prevent any chronic disease, and cancer is definitely one of those, any more than a conventionally grown food. So therefore, I certainly have no problem with a person that has the resources and can afford to eat organically, but I'd say probably 95% of my patient population eating organically would be a definite hardship. I do encourage people, if you know about local farmers markets, to check them out. I know here in the Salina area, there's now I think 3 going on, and the season, probably starts in, late mid to late spring and ends in fall. And there again, we do know that organic foods have lower pesticides, residues. They don't include a lot of man-made additives, but it's a good stewardship to our land and our resources. But like I said, I just want you to realize that there's no proof that eating conventional fruits and vegetables that you just get at any supermarket cause cancer or make your chances for a cancer diagnosis any more prominent. On the back of this handout, it does give a list of some of the foods that are probably known as the dirty dozen and maybe have a little bit more pesticide residue, and it does give the clean 15. So that might be something that a person is interested in, and so I'm happy to provide that handout. The next really hot topic in breast cancer survivorship is soy and breast cancer. Currently, the research has really proven that soy foods are safe for women with a breast cancer diagnosis to eat, but I would really emphasize to you that we want the whole soy food, just like I want you to try to eat foods that are not as processed in general. The same goes with soy food. I want you to eat tofu or edamame or soy milk. I do not want you to eat like a powdered soy or maybe a soy protein bar that has a lot of, I call it like mega dosing, where they've added maybe 250% the amount of soy that's recommended for the dietary allowance. So anyway, I have a handout about that. I also on this, it does include what the appropriate serving size for soy foods are, and that might give you some guidance if you're interested in that. I'll be very honest here, I don't recommend that if you don't eat soy, that this is an urgent, that you go out and start including soy foods. I just perceive my job as hopefully giving you accurate information so you can base a decision or make a choice on that. Another handout that I have that I give out is called Nutrition for Breast Cancer Survivors. It discusses a lot about how you can lose weight safely if you need to do that. It talks about reaching and maintaining a healthy weight. It gives you like a sample lower calorie, lower fat menu in here. And it just, like I said, gives you some different tips for how to achieve a healthy weight diet. And that's often a really popular handout. Another really hot topic that I discuss is sugar and cancer. Is there a connection? And I'm going to be honest with you, this is really one that it's really, I can't really probably explain it as in depth as I would need to, but I'd be happy if somebody calls me or if somebody is interested in this topic. But this is a really good handout called Sugar and Cancer. Is there a connection? And it explains that really sugar does not truly feed cancer, but that we all have a hormone called insulin that really helps anything you eat. Doesn't matter if it's a protein or a piece of pie, which has a lot of sugar in it and fat. Doesn't matter what the food is, everything we eat gets converted to glucose in our body. And glucose is what feeds every cell in our body. And we have a hormone that is a growth hormone called insulin. It helps unlock the door to the cell to let that glucose in to feed. And so the idea is you really don't want to rev up that insulin by eating like candy, Pop-Tarts, sugar, sweet cereal, pie, cake, candy, cookies, those kinds of things. And so this really explains it in a very understandable way. And the thing I really like about this handout, it has all the references from which the research was done on this topic to hopefully clarify it, because to me this is kind of a scary statement that sometimes patients get told by well-meaning relatives and friends. So that's really another good handout. Another question I get asked all the time is about juicing and cancer. I don't have any problem with juicing as long as I tell patients the biggest thing is I want you to get food first. So that means that if you still have some calories left that are available to consume in your day, that then, sure, go ahead and juice, but just realize that juice can be really concentrated and it can actually have a lot of sugar and calories in it. And so I think it's really important that you just realize that if you're currently eat 5 or more servings a day of fruits and vegetables, then juicing to boost the intake of those foods can be perfectly healthy. But you just want to be sure that you're getting it from food first. The problem with juicing is you're not going to get the fiber that you would get from those healthy fruits and vegetables. And so this handout just talks a little bit about juicing and some of the different struggles with it, and some of the just some good ways to incorporate it into your diet if you're really interested in that. A lot of times I do get asked, well, are you vegetarian? And I will say, no, I'm not, and I really don't. I don't really try to encourage my patients to be vegetarian. Like I mentioned earlier in my talk, we do, I think, have a portion distortion in this country where we just tend to eat too much at a time when we do eat. And I think if we're all eating, a typical portion of meat would be the palm of your hand and about the same thickness. And if we're eating a proper portion, then I think meat certainly is a healthy component of your diet, and there's no problem to eat that. I do tell patients that some women I know worry about antibiotics and other hormones that might be added into the food supply, but I think some of our retailers have responded very nicely. I know that Dillon's has a product called Simple Truth. They also have a product called Smart Chicken and Laura's Lean Meat, and all those products are raised with no antibiotics and they're hormone free. So Brahms is another retailer that really has a lot of good products as far as their milk and their yogurt and their cheese and their meats. So I think there again, you don't have to seek out a special producer, if you will, to purchase those kinds of things. But there again, if you have time and you can go to a farmer's market, there are a lot of people in the area that do pride themselves on raising their food, what I would call in a really healthy environment and not using a lot of chemicals and additives. And if that's what you're interested in, they'd love to talk to you at a farmer's market. I did bring some other resources today as far as I taught one of my big pet peeves right now is we get a lot of sugar in the things we drink. This example would be, it's just a test tube that's full of sugar, and this is how much sugar is in 1 cup of Mountain Dew. And so Mountain Dew typically is in a 12-ounce serving, not a 1 cup serving, which is 8 ounces. So I usually share these with the participants when they attend a class and just show them the different amounts of sugar. Another thing is going to Starbucks or McDonald's and getting that mocha drink or that coffee drink. They're just loaded with sugar. And so I have actually a notebook here that kind of talks, and really eating this way and avoiding those things helps prevent heart disease and high blood pressure and a lot of other chronic health issues besides cancer. But I have a notebook here with some just pictures of like a drink from McDonald's and a drink from Jamba Juice and how many sugar cubes are in it, and also some like salad dressing and spaghetti sauce and like a cinnamon roll. And then as you can see, I've got some fruits on the next page, and that will kind of show you a comparison. Oh, here's a McFlurry. It's got lots of sugar cubes in it too. So this just helps give you a really good visual idea of what we're talking about. And like I said, sugar in the diet has really become a huge issue at this point. In the front of this notebook, I have a really good article that just talks about how sugary beverages are causing the general public a lot of harm, and what some of the risks are with eating too much sugar in your diet. I have some fat test tubes here, and basically they do a comparison between like maybe a regular salad dressing and a salad dressing that is a lower in fat. And then I also have some salt test tubes, and they show you some of the salt. Basically, the average American gets 2 teaspoons of salt in their diet, and this is the recommended amount is 1 teaspoon. So we're getting about twice what the recommended amount of salt is per day. That is part of the reason I want you to eat less processed foods. There's a lot of salt in processed foods. When you shop, I really encourage people to stay to the perimeter of the grocery store, because that's going to be your produce section and your dairy, your eggs, those kinds of things, versus in the middle is where we get into trouble with a lot of foods that are going to be more processed. A lot of times I have patients that ask me about if I'm really recommend a cookbook or any kind of resource when they're done with treatment. I have a couple of different cookbook resources that I bring to show them. The Pink Ribbon Diet is a really good one, and this is about a new weight loss plan to lower your breast cancer risk. And this one is a little bit more what I would call vegetarian, so I always say to somebody, I don't want you to think this means that I'm telling you to become a vegetarian. It's just based a little bit more on an olive oil, and actually on a virgin olive oil as the main fat source, and it does give some really good recipes in here that you might be interested in. I do have a dietitian's cancer story, and basically this is a three-time survivor that has had cancer, and she was a child when she was first diagnosed and had a childhood cancer, and unfortunately I think they think maybe she got cancer again later in life because treatment wasn't as basically just as effective, and it affected some of her other areas when she was treated. But she's really what I would call stricter. So to me, I think it's just more what you're looking for, and I would probably ask you individually what your goals are and how strict or how into it you really want to become, and what your schedule is, and what your goals are. And then the American Cancer Society puts out a great book called Nutrition for Cancer Survivors, and it's got all kinds of great information in here. It's got about dietary supplements and all kinds of information, certainly, that's you might find interesting. Another one is The Cancer Fighting Kitchen by Rebecca Katz. She's a very well-known author, and that's a really good cookbook. But there again, I'll be honest, I think she really pushes becoming vegetarian, and I probably just want to make it clear that I'm not. I probably, if you, a lot of times I'll get asked what I personally think people should follow, and I really like the Mediterranean diet pyramid. This basically does let you, of course, they really emphasize that we need to eat more fish and seafood. It has the activity at the bottom of the pyramid. It talks about fruits and vegetables, olive oil, beans and nuts is the huge area in the center, so that's the focus of this pyramid. It talks about drinking water, and then fish and seafood, and then your poultry and eggs and cheese and yogurt are here, and then at the very top are meats and sweets. And that's probably my personal preference if I get asked to share that with the group. Like I said, hopefully a lot of this information will be useful and helpful to you. I really want to encourage you to call the Cancer Center if you have any questions and you want me to mail you any of these handouts, or there again, if you're listening to this before you're done with treatment, I'll be more than happy to provide any of these handouts that you're interested in. As far as frequently asked questions, I've kind of tried to make a few items that I get asked about often that would hopefully interest you guys, and some of the newer things I get asked about, although they kind of recycle, I'll be honest. But right now, spirulina is a blue-green algae, and it's just a real hype right now that it's going to help cure every ill that any ailment that humans have, and basically that's not really what it's showing to happen, unfortunately, and they even know now too that it can be contaminated. So if you do look into this, you want to basically be sure that you're getting a pretty pure form, because they know it can be contaminated with toxins and heavy metals. So that's something that I usually don't recommend to people. But there again, they do also know that it can interact with some of your medications, so I would probably, if you're on an anticoagulant or if you're immunosuppressed from cancer treatment, this would definitely not be a supplement that you would want to do. Wheatgrass is another kind of hot topic going on now, and there's a couple of different forms of the wheatgrass that you can get wheatgrass juice. And right off on I was on basically the natural standard and natural medicine database. That's a very reputable website, and I have that written out on a handout that I can give you with just reputable websites, period, on it. And it says that unfortunately this has not been shown effective in treating cancer or preventing cancer. Basically, wheatgrass is prepared by sprouting wheat seeds in water for about 7 to 10 days before you harvest the leaves, because the leaves are fibrous and a little difficult to digest. So lots of times that's how they decided to do the juicing, because if you eat it like that, I think it can cause some indigestion and stomach upset. And then you can also find wheatgrass in a powder form. Of course, wheatgrass juice has been claimed to neutralize toxins in the body and carcinogens in the body, but like I said, none of these claims have been supported by clinical studies. Another newer or more interesting natural medicine is turmeric, which is just a spice that you can buy at the grocery store. Basically, this is just a plant that they grow in India, and it's actually the root or the rhizome of the turmeric that they harvest. And it's been used there in India for like GI upset and arthritis pain. But when you look at it for, like I said, the Natural Standard and Natural Medicine's Comprehensive Database, which I do really recommend, it's very reputable, it says that it's there's unclear scientific evidence for this use. Although I do think they're doing some studies about its antioxidants powers, so I think we may see a little bit more, and maybe this may be one that eventually we'll be able to hang our hat on a little bit better, if you will. So those are kind of some of the newer things that I get asked about. I think that pretty much summarizes what I'm trying to visit with you today about. There again, I just really try to, if I was going to summarize everything, just try to eat foods in their more whole form. And I always say, it's really easier and faster to cook if you're not making an extra sauce or gravy or something like that. Obviously, spices can be very useful, and so I try to tell people to get a little more excited about seeing what they've probably already got purchased and in their cupboard at home, and cook with it. And like I said, that's going to give you a lot more benefit than adding a high-fat sauce or cream sauce to something. There again, I can't think of anything I'm leaving out, so thanks for your attention.